Hi, this is Dr. Georgina Peacock from the Georgia Department of Public Health, and I'd like to welcome you today to our COVID-19 Vaccines for Women webinar, Myths versus Truths. Next slide, please. Okay, and here's the agenda today. So we will have an introduction by our Health Commissioner, Dr. Kathleen Toomey, and then we'll turn the slides over to Dr. Denise Jamieson, who was going to be talking to us about vaccine myths and truths, followed by a question and answer session, and then a wrap up. So thanks for joining us here today, and now I'll turn it over to Dr. Toomey.
Thanks so much, Dr. Peacock. I wanted to welcome everybody today and thank you for being here. This is a very important, I think, topic for discussion. I've had the privilege of traveling around the state the last 6 weeks or so, and the questions that we are going to talk about have come up consistently in all of my meetings in many communities. And so I think that as we can get the most accurate information possible out to everyone, it will be extremely important to put people's minds at ease, and particularly women's minds at ease about the value, safety, and efficacy of the vaccine. We're so pleased to have Dr. Jamieson here with us, who's an internationally recognized OBGYN leader as well as epidemiologist. But before I turn it over to her, I just want to say for you providers, regardless of your specialty on the phone, we know from our surveys, and we've done many surveys throughout the state, that for many people, their physician is the single most important person who they trust with information about the vaccine. It's not the Commissioner of Public Health, and it's not necessarily someone else on television. It's your provider. And so I really encourage you, even if you yourselves are not giving the vaccinations in your offices, to please remind everyone how important this is, and particularly now armed with this additional information. So with that, let me turn it over to Dr. Jamieson with thanks for being here with us today.
Thanks so much. Happy to be here. Next slide. And next slide. So I want to go through a series of myths that I've heard and sort of separate out the myths from the truth. Starting with this, because COVID vaccines were developed so quickly, corners were cut in terms of safety. Next slide. This, of course, is a myth. Next slide. The truth is that COVID vaccines were developed very quickly, but carefully. So it's true that the vaccines had to be developed rapidly, and this was needed in a pandemic, and it really represents an example of remarkable scientific innovation and achievement. In the clinical trials, the same processes were followed. So some of the steps of the clinical trials were done simultaneously rather than consecutively, but all the steps were followed in the clinical trials. In addition, all the steps in the approval process were followed. So the FDA, working with their Independent Advisory Council, or VRBPAC, issued an emergency use authorization for all three of the vaccines that are now available. And because the vaccines were going to be used in larger numbers in an overall healthy population, the EUA criteria were actually stricter than usual. And once the EUA was established for each, then the CDC, working with their Independent Advisory Committee, or the Advisory Committee on Immunization Practices, or ACIP, determined how to use the vaccine. So again, all the steps for the vaccine were developed according to the usual process, but just in a more rapid way. Next slide. So pregnant women should wait until after delivery to get vaccinated. Next slide. Again, this is a myth. Next slide. So the truth is that if infected with COVID, pregnant women are more likely to have severe disease, and their babies are at increased risk for preterm birth. So pregnant women should get vaccinated to protect themselves and the health of their baby. So the best data about severity in pregnancy come from the CDC surveillance system of case reports. And we now know that pregnant women are at increased risk of hospitalization, of requiring intensive care unit admission. They're more likely to need mechanical ventilation, and they're more likely to die if they're infected with COVID. We also know there are effects on their babies. So preterm birth rates are increased, and other effects such as preeclampsia are increased. There may also be an increased risk of stillbirth. And so there are many compelling reasons why pregnant women in particular should be vaccinated to both protect themselves and to protect the health of their baby. Next slide. So the next statement, because pregnant women were excluded from clinical trials, there's not any information about the safety of COVID-19 vaccines in pregnancy. And this, of course, is a myth. Next slide. The truth is that there is now substantial and reassuring information that the COVID-19 vaccines are safe in pregnancy. So it is true that pregnant women were excluded from the initial pre-EUA clinical trials. And so what we knew about the vaccines at the time of the EUA issuance was limited. So for example, the mRNA vaccine, we had some animal safety data. We had some women who were enrolled in the clinical trials inadvertently, not realizing that they were pregnant. In terms of the J&J, Johnson & Johnson vaccine, we had a little bit more information about that vaccine platform because there's an Ebola vaccine that's used in pregnant women using the same technology. But things have really changed since the initial issuance of the EUA. We now have over 100,000 pregnant persons in VSafe, the CDC surveillance system that monitors safety using smartphone technology, and many more than that who've received the vaccine. So we now have good data that short-term side effects such as fever and redness at injection site and fatigue are all similar in pregnant and non-pregnant women. We also have over 4,700 women enrolled in a CDC FDA birth registry, and we have rapidly accumulating safety data with no safety signals, no indication of any adverse events that are more common in pregnant women who are vaccinated. So reassuring overall. Next slide. So the next statement is most vaccines are not safe for breastfeeding women. Next slide. And we know this is a myth as well. Next slide. So most vaccines, including COVID-19 vaccines, are safe for breastfeeding women. So we routinely give nearly all vaccines to breastfeeding women, even live vaccines like measles, mumps, and rubella, which are not considered safe in pregnancy because there's a theoretical risk of transmission to the baby. But even MMR we give to breastfeeding women. So this whole notion linking lactating and pregnant women is really misguided. We really need to think about breastfeeding women separately. And as I said, even live vaccines are given to breastfeeding women. Next slide. So the next statement, COVID-19 vaccines cause infertility. This is also a myth. Next slide. So there's not any evidence at all that COVID-19 vaccines affect fertility in either men or women. And I want to spend a little bit of time on this because this is sort of an interesting story and I think a testament to the power of social media in propagating some of these harmful myths. So there was an article posted on a blog, Health and Money News, by a retired British doctor who lost his job at Pfizer more than 10 years ago. And the name of the title of the article was Head of Pfizer Research, COVID Vaccine is Female Sterilization. And this was based on a false claim about syncytin 1. Syncytin 1 is a protein which plays a critical role in the development of the placenta. And the false claim was that the coronavirus spike protein and this placental protein that's necessary for placental development are similar. And therefore, the vaccine would train the body to attack the placental protein as well as the coronavirus protein. Well, first of all, the two proteins are not similar. They share only a very similar small stretch of material. And there's no evidence or even biologic plausibility that COVID vaccines cause infertility. And if you go back to the source of this myth, this British doctor who previously worked at Pfizer, he was also known for posting fairly outrageous claims on Twitter. So one of his other quotes was on Twitter, quote, "There's nothing especially virulent or frightening about COVID-19. It'll all just fade away. It's a common garden variety virus to which the world overreacted." So again, this was based on someone posting false claims, and it's one of those myths that's been propagated in healthcare settings. I hear it a lot from healthcare, particularly female healthcare providers, and it's not based in any fact. Next slide. So the next statement, COVID-19 vaccines cause problems with menstruation. This is also a myth. I shouldn't say myth, this is also unproven. There's no evidence that COVID-19 caused problems with menstruation. This one's a little harder to tease out. A piece of this is definitely false. So there have been false claims that COVID vaccines cause menstrual problems, and even that someone nearby who's been vaccinated can disrupt a woman's cycle. So in terms of the piece about someone nearby who's been vaccinated disrupting a cycle, we know that vaccine ingredients are not capable of leaving the body that they were injected into. Vaccine ingredients and proteins they produce can't replicate, they don't cause infection, and therefore they can't spread the way, for example, viruses can spread from person to person. So that piece is definitely false. The piece about vaccines causing menstrual irregularities is really harder to study. There are so many factors that affect menstruation: stress, sleep, changes in weight, infections, many diseases. Cycles can vary, they change over time. And so it's a really hard issue to study. It really requires daily diaries, and to study this properly, you'd have to conduct a study where you randomized women to vaccination and not to vaccination and studied their menstrual cycles. And that's not a feasible study design. So I do think that we'll get more evidence, but there's no current evidence that vaccines cause menstrual irregularities. And I don't know of any other vaccines that have been demonstrated to cause irregularities in menstruation. Next slide. So the next statement is COVID-19 vaccines can cause early menopause. Next slide. We know this is a myth. Next slide. The fact is there's no evidence that COVID-19 vaccines cause early menopause, and I'm less clear about where this comes from. There are theoretical risks, and it's been suggested that perhaps COVID is more severe for menopausal women versus younger women, due to immune changes, decreased estrogen associated with menopause. But there's certainly no evidence that vaccination in menopause is any different in terms of safety or effectiveness of the vaccine. So again, another myth. Next slide. Next statement is if you've been previously infected with COVID-19, you don't need to get vaccinated. Next slide. This is also a myth. Next slide. So even if you've been previously infected with COVID-19, it's still important to get vaccinated. We don't yet know how long protection lasts after infection or after vaccination. There are some caveats. So if you were treated with monoclonal antibodies or convalescent plasma, you should wait 90 days. So for patients who have been recently infected, they should talk to their healthcare provider about the best time for vaccination. Next slide. So the next, I've heard two statements. First of all, J&J vaccine is inferior because it causes blood clots. And I've also heard Moderna and Pfizer mRNA vaccines are inferior because it is newer, untested technology. Next slide. So these are both myths. Next slide. The truth is that all three available COVID vaccines are safe and effective, but there are some subtle differences between them. So in terms of the first statement about J&J, as you know, in April, there was a brief pause in the US because there were reported cases of what we now call thrombosis with thrombocytopenia syndrome, or TTS. This is a serious clotting disorder and has been reported mostly in females ages 18 to 49, although there have been cases in men. It's rare. It is now estimated that there are approximately 7 cases per 1 million doses of J&J vaccine administered. And that led people to think, well, since the risk of thrombosis is increased during pregnancy and postpartum and with certain types of hormonal use, perhaps the J&J vaccine is not the best vaccine. But it's important to remember that the mechanism of thrombosis is different. And there's no preference in terms of whether pregnant women or women of reproductive age should receive the J&J versus the mRNA vaccine. In terms of the technology, it is true that the mRNA is brand new vaccine technology, and it's actually very innovative and elegant. mRNA is very unstable. It's housed in this lipid nanoparticle. It enters the body and instructs the body to build spike proteins to the coronavirus, and the body mounts a robust immune response. And then the mRNA rapidly degrades. So it's thought to be, very briefly, the mRNA components of the vaccine are thought to be in the body for a very short term before they degrade. So really, all 3 available vaccines, 2 mRNA and 1 adenoviral vector vaccine, are all safe and effective. There are some advantages and disadvantages to each. J&J is, of course, 1 shot. mRNA is 2 shots. They each have specific storage and administration requirements. And so, you know, there may be differences between the 2 that may be important for your patients. You know, mRNA is highly effective, very safe. J&J may be a good option for those who it's not feasible to get the second dose. And so I would say the important issue is that patients get people get the vaccine that is available and right for them. Next slide. So in terms of the decision to get vaccinated, I know many people are struggling with vaccine hesitancy. And what I tell my patients is that the decision to get vaccinated is really a critical decision, not only for you, but for your family. You may have family members who can't get vaccinated, and for your community. Whether or not you get vaccinated and whether others in your community get vaccinated also has implications in terms of safety in schools and other settings. So I think it's critical that people have the best available information to inform decisions about vaccination. Thank you very much, and I'd be happy to answer questions.
Dr. Jameson, it looks like we have one question in the Q&A right now, and that is, if a woman is vaccinated and breastfeeding, will the infant have passive immunity?
So we don't yet know. We hope so. So we have fairly good evidence now from several studies that antibodies can be passed from the mother to baby across the placenta, so that babies are born with antibodies. We also have some limited evidence that breastfeeding can also confer antibodies to the infant. What we don't yet know is whether they'll be those antibodies will be protective and protect the baby. We hope that they will be. I think that they should be, hopefully, similar to what we see with Tdap and with influenza, but we don't yet have the evidence to say definitively that the antibodies that are passed to the fetus or to the baby are protective.
Looks like there's another one here. As someone who has gotten the vaccine, postpartum, and currently nursing, and planning on becoming pregnant again in the near future, are there any universities or other such things that we can submit our data to for research to help?
Thanks for asking that question. Yes, there are studies, and very kind of you to think of contributing to science. I would talk to your healthcare provider depending on where you're delivering. Here at Emory, we have 2 ongoing studies, one on the Emory healthcare side and one for our patients who deliver at Grady. There are also national ongoing registries and that you can enroll in, one out of UCSF, for example. So I would talk to your healthcare provider about any ongoing studies. We're also going to be starting additional vaccine studies at Emory. So I also see a question in the chat about, is there a preference in terms of trimester about when to get vaccinated? We currently recommend that you get vaccinated when you are able to, now that the vaccine availability is much more open. We recommend that you get vaccinated as soon as you can because there's ongoing COVID transmission. So for every day that you are unvaccinated, you are at risk of getting COVID. It is true that right now we have more information about pregnant women in the 3rd trimester than we do about the first 2 trimesters. The evidence is rapidly accumulating through the surveillance systems I mentioned, such as VSafe. But because of the short amount of time that's passed, a lot of women who were vaccinated in the 1st or 2nd trimester haven't yet delivered. So we're hoping by June or July that we'll have more information.
There's another question here, Dr. Jameson. Is it truly a vaccine? I think this question is about, is there potential that this will be a yearly thing?
Yes, there is the possibility that the vaccine will have to be given, a booster vaccine will have to be given, both in terms of to ensure durability, long-lasting protection from the vaccine, as well as if there are variants that emerge that are important in the United States, we may have to get ongoing booster vaccines, but that has not yet been determined.
Another question here. How would you respond to a parent who is hesitant to vaccinate her daughter going off to college for the first time?
I think it's really important to find out, to sort of meet the person where they are and find out why they're hesitant as a parent, why they're hesitant about getting their daughter vaccinated. There are compelling reasons to really focus now on younger people. And as we know, we're hoping that there's an EUA for the Pfizer vaccine for 12 to 15-year-olds very soon, this week or next week. Because if you look at where the transmission's now occurring, it's occurring in the younger age groups as more and more older people have been vaccinated and more kids are returning to school and sports and activities. We really want to ensure that they are protected against COVID. And if you look at college students, that's another really important population. And in fact, some college campuses are requiring vaccination, particularly if the students are going to be housed on campus. So for example, to live on campus at Emory, students are required to be vaccinated.
There's one here about status and consent forms. Is there a reason to continue to ask questions about pregnancy and breastfeeding status on consents for vaccination? This is a cause for concern when the woman is asked those questions, but then told that there is no contraindication.
I think that's a really good question. I do think that specifically calling out whether or not you're pregnant does send a rather mixed message about the safety of the vaccine in pregnancy. And since we are vaccinating pregnant women regardless, or offering the vaccine regardless of pregnancy status, I'm not clear that that's something that needs to be called out on a consent form. The other thing that was happening, and I'm not sure if it's still happening, is that some vaccination sites in Georgia were asking for a healthcare provider note certifying that the woman had talked to her obstetrician or OB provider prior to vaccination. And ACOG, American College of OBGYNs, which is the professional organization of obstetric providers, very clearly states that that should not be a barrier to vaccination. Pregnant women should not be required to have a conversation with their obstetric provider prior to vaccination.
Next one here. We are hearing that many OBGYNs in our community are hesitant to give encouragement to their patients to get vaccinated, and is causing a lack of confidence in women of childbearing years. How is DPH working to help educate the medical community about these myths/truths?
So I can comment from the national side. I think there has been a fair amount of confusion about what the recommendations for pregnant women are. And part of that is that CDC and ACOG have said that pregnant women should be offered the vaccine. Pregnant women, the vaccination should not be withheld based on pregnancy status, and that pregnant women are at increased risk for severe disease. But I think what we have not clearly communicated is that pregnant women, the vaccine should be recommended for pregnant women. The way we recommend the flu vaccine or Tdap for pregnant women. And I think that reluctance has been because, as I mentioned, we're just accumulating data, particularly from the first and second trimester. So I think that language will be strengthened. But as I say, you know, even though the national recommendation is to offer vaccine to pregnant women, when I talk to my patients, in nearly every case, I recommend the vaccine for pregnant women because of the risks of COVID and the benefits of vaccination.
And Dr. Jamieson, this is Kathleen Toomey. Let me just address the many things that Georgia Department of Public Health is doing. This webinar is an example of one of the things that we are doing. We are also posting information, you know, on websites. We are also have sent letters out to all providers that contains this information that go to every licensed physician statewide. So these are the sorts of things that we are doing to try to educate broadly the provider community. If there's some other things that you would like us to be doing in addition, please let me know, and we can certainly enhance the work that we're doing in this area to ensure that everyone has the most up-to-date and accurate information. Thank you.
And I think it is really hard. I mean, the other day I was talking to one of our obstetric providers, and I said, and I ask everybody I see now, everybody in the grocery store and everywhere, if they're vaccinated, and try to talk to them about their hesitancy if they are vaccinated. And sort of the two examples I can give is of a plus and a minus is I asked one of our OB providers, are you vaccinated? And I was surprised. She said, no. And I said, well, why not? She said, well, I'm waiting. And I said, what are you waiting for? To get COVID? Think about the risks, you know, of not getting vaccinated versus getting vaccinated. By contrast, I asked someone who I work with at Grady, who works in environmental services, and she cleans our call rooms. And I asked her several months back, I said, are you going to get vaccinated when it's available? And she said, oh, I am so afraid of that vaccine. It's just so new and I'm so afraid of the vaccine. And she paused for a minute and said, but I'm more afraid of COVID. You know, I see what COVID does. And so I thought that was one of the best responses that I've heard, you know, acknowledging that she had some hesitancy, acknowledging that she was slightly afraid of the vaccine, but also, you know, having worked in a hospital that's seen a disproportionate number of COVID cases, also understanding the risks of not getting vaccinated.
There's a question here about rumors and stories on social media regarding breastfeeding children of vaccinated women developing blood clot issues. Anything you can say about that, Dr. Jameson?
I had not heard that one. There's no evidence or even theoretical theory, biological plausibility that would occur. In terms of vaccine safety in breastfeeding women, I just want to reiterate that in general, we don't give live vaccines to pregnant women. We don't, and live vaccines, the best example is the measles, mumps, and rubella vaccine. Also smallpox vaccine, which we don't commonly use now, but is used in specific circumstances. There is evidence that smallpox vaccine, if you give smallpox vaccine to a pregnant woman, it can be transmitted, the vaccinia virus that's in the vaccine can be transmitted to the baby, and there are examples of that happening. Which is why we don't give live vaccines of pregnancy, and for the same reason we don't give measles, mumps, and rubella. But we do give measles, mumps, and rubella to breastfeeding women routinely if they're not immune before they leave the hospital. We vaccinate with MMR. So I think it's really important to remember that vaccine safety in and we've been doing that for many decades. So vaccine safety overall in lactating women and breastfeeding women, vaccines are very safe. And so I don't have concerns about the COVID vaccine being given to breastfeeding women and for those women to continue to breastfeed safely.
Question here about mammograms. Why are women encouraged to not get a mammogram for a few weeks after getting the vaccine?
That's because the mammogram can be falsely positive on the side, particularly on the side that you get vaccinated. So if you get vaccinated in the right arm, you can get some lymphadenopathy on the right side that shows up on a mammogram as an abnormality. And so to ensure that you don't get a false positive on a mammogram, it's recommended that you not get a mammogram within a few weeks of getting vaccinated. But again, that shouldn't be a barrier to getting preventive health care. Here at Emory, when a woman calls, we schedule the mammogram for outside of that window of vaccination, but we make sure to schedule the mammogram so that it's not missed.
Quick question on the origins of some of the rumors, not dissimilar to the question before last. How did the rumor that the vaccine causes infertility come about?
So that infertility question was based on the claim that the syncytial protein that's necessary for growth of the placenta is similar to the coronavirus protein, and it was a false posting on social media because they're not similar and there's no evidence of it causing infertility. And then it got expanded from female infertility to male infertility. And I can say it's one of the most tenacious myths. I was relieved to sort of figure out where the myth came from after digging a bit to find out that it's clearly one of these social media myths that won't die. And I was glad to understand where it came from, but even in understanding its origins, it seems to continue to circulate. There have been a number of reputable news organizations that have reported on this, New York Times and some other news organizations, but for some reason this just has real legs in the community, and I think it's really important to educate people that this is purely a myth. In contrast to the menstruation, which it may be, I mean, there isn't a vaccine that I know of that causes menstrual irregularities. So many things affect menstruation. But again, I don't think any potential changes in menstruation should alter people's willingness to get vaccinated. And again, there's no evidence that it actually does alter menstruation.
One final question here. Oh, another one just came in, but someone is interested and was in the AstraZeneca trial and is now interested in how they might be able to get a vaccine card. This may be open to the rest of the folks on the call as well. Any guidance to be provided there?
This is Dr. Peacock. Maybe I can help with that. So if you've been in the AstraZeneca trial, I would talk with the people running the trial to see if they will issue you a card that says that you received the AstraZeneca vaccine. Now, that is not a vaccine that is currently under emergency use authorization in the United States. So, it's important for you to know that.
Thanks, Dr. Peacock. A couple more have trickled in. Have you seen an increased risk of HPV with vaccinated individuals?
I have not. That is new to me. I have not heard of anything related to HPV risk being altered. I don't know why HPV risk would be altered with vaccination. I'll have to make a note of that and figure out where that came from. But I can't see any biologic plausibility, and I know of no evidence. But please let me know if anybody else has heard this.
You touched on this a bit earlier, but there's another question. What do you say to doctors, PAs, nurses that haven't received the vaccination, but are willing to vaccinate others?
It's interesting. I feel like working in healthcare, we have an obligation to do everything possible to protect our patients. And so I think part of that responsibility during a pandemic is getting vaccinated. We have patients who have started asking our providers, are you vaccinated? There are patients and people who cannot be vaccinated or cannot mount an adequate immune response to a vaccine. And so I personally think it's very important for us to not only be role models, but to also take personal responsibility for protecting our patients, and protecting patients in the midst of a COVID pandemic, I think, is getting vaccinated for COVID. Oh, the question said herpes zoster, shingles. That I do not know either, but I will look into it. Herpes zoster. Thank you for the clarification.
One more question here. How should a pregnant woman who already got vaccinated, but then still got COVID-19, take care of herself? Any differences? Is the protocol the same? How about medication?
So that's interesting. We are, the failure rates of being fully vaccinated and then getting COVID, it's still relatively unlikely, but it is possible, and we are seeing more cases. So I'm sorry for that person that they got vaccinated and still got COVID. The differences in pregnancy, so there's no difference. I mean, hopefully COVID is less severe in a previously vaccinated person. In terms of the medical care for a pregnant versus non-pregnant person with COVID, there are some subtle differences, but the overall principles for taking care of that person are very similar in pregnant and non-pregnant persons with COVID. Oh, someone just posted a USA Today chat about genital herpes. I'm going to have to look into this. This is the first I've heard of it, so thank you to those of you who are posting in the chat.
Another question here. Are there any studies regarding women trying to get pregnant who had miscarriages or problems getting pregnant after getting the vaccine?
So couple pieces to that. So in terms of miscarriage associated with COVID vaccination, that is one of the outcomes that's being tracked in VSafe, and there is some preliminary information that there's not an increased risk of miscarriage. In terms of decreased fertility, I think that goes back to what we were talking about before. which is there's not information that COVID vaccination affects your chances of pregnancy, either short-term or long-term. And when I'm counseling patients who want to try and get pregnant or planning to get pregnant, either naturally or through assisted reproductive technology, one of the things that's important is for her to be fully vaccinated against all appropriate vaccine preventable diseases before starting pregnancy, so that she starts the pregnancy protected. And so COVID in these times should be part of one of the important vaccines that she receives prior to pregnancy, ideally.
And I believe this will be our last question. Is there an infant safety and efficacy study in place for the cohort of pregnant women who received the vaccine in the first trimester?
There are several studies. The largest safety initiative in the US is being led by CDC, and that's the VSafe that I mentioned. So pregnant women enroll using their smartphone. They indicate that they're pregnant. They then get called and given the opportunity to enroll in the registry, and the registry follows the pregnant women through delivery, and the infants are followed. I can't recall for how long. There are other efforts, including some international efforts, to follow babies long term. The UK, for example, has a very nice OB surveillance system for pregnant women and their infants, and they are following both COVID-infected patients as well as vaccinated patients.
And then there's a question that's being submitted frequently. For those asking, this webinar will be distributed. It is being recorded and will go out to all of you.
All right, this is Dr. Georgina Peacock. So I would just really like to thank you, Dr. Jameson, for presenting to us on such an important topic. I think understanding these truths about vaccines will help people understand the COVID vaccine better and be more comfortable with vaccination. If you or a loved one has not been vaccinated, or one of your patients, we hope that this information will help you in making those decisions. Here on the slide right here, we've posted some more information from the Department of Public Health that takes you to the COVID vaccine website. You can also see that there are ways to schedule appointments through the Department of Public Health webpage, or if people are having trouble navigating the online services, you can also call a phone number that's listed here, 888-457-0186, and they will help you schedule an appointment for a vaccination. There are many opportunities to get vaccinated across Georgia. Most pharmacies have COVID vaccination. Many healthcare providers now have that. We are doing some work also to make it easier for smaller practices to be able to vaccinate by providing them with fewer doses of vaccine at a time. So I encourage you to share this information with those that you talk to about who are having concerns or questions about vaccination. And again, thank you, Dr. Jameson, and everybody be safe.
My pleasure. Thanks so much.